Our next speaker is Milena Argirović, country head Serbia, Montenegro, Albania, North Macedonia, Kosovo, Takeda, who will discuss how telemedicine can protect our healthcare system, patients, and the planet.
Good morning, ladies and gentlemen. Before I start, I would like to thank a lot to Sustineri partners, to Porto Montenegro, and to the Government of Montenegro, first of all, for the idea of this event, for organization, execution, and for being a wonderful host over the past couple of days. I'm here to represent Takeda, which is a specific company with a Japanese heritage, but being present globally. And what is so specific about Takeda? First of all, the fact that it was founded 242 years ago. So it's a 2.5 century old company. But what is very specific to it is that for the last 2.5 centuries, the company is living the same values. And in the heart of our values is the integrity. It's something that people traditionally link to Japan and Japanese society, very high level of integrity. And the second thing that is first thought when we think about Japan and Japanese society is that this is the country of the future. And I'm very glad that the motto of this conference is the business of the future. That Japan is traditionally perceived as a country with a high level of innovation and providing high-tech products and solutions. And this is completely true. Before I start to present to you how do we drive this technology innovation in the healthcare as Takeda, I would like just to present what inspired me from yesterday's speeches. And there are 3 quotes that I wrote down. First one is that there is no long-term profitability without sustainability. The second one is that the time for change is now. And the third one is that we have the obligation to leave the legacy to our children, grandchildren, and great-grandchildren. And telemedicine is reflecting all these 3 sentences. It all started as majority of innovative projects during the COVID times. And it started like the patients and the patient associations approached our company for the very specific chronic condition that we are dealing with. It's called inflammatory bowel disease. And they were desperate because during the COVID time, they were not able to be in the constant touch with their healthcare providers, with physicians and nurses that were responsible for their health. And someone might say, okay, but there are different ways to make a video call with the physician. What's the big deal about it? But the big deal was because the healthcare is a specific environment. Within the healthcare, we have to keep records, especially when the condition is chronic, such as inflammatory bowel disease. Whatever is happening with the patient has to be recorded and tracked during time. Therefore, we had a very difficult task to implement this telemedicine within the public healthcare system, within the existing softwares, in order not to add additional work to physicians and to the healthcare system that was already stretched during the COVID time. And this is, as Masha said at the beginning, where we had a specific challenge how to find partners that are not our traditional partners in our daily job, because usually we partner with the physicians, with nurses, with pharmacists, and so on and so forth. Here, we had to find the partners that we don't know. First of all, the software company who developed the software for the public healthcare system. Second of all, to find people in the government that can support us with the regulation change, and so on and so forth. And we started to look for them one by one. We found them, and we started the partnership. And I have to say that we are very proud that we had a great support. Once we presented the project, because it was, first of all, not a traditional one. Second of all, usually pharma companies are providing only product supply and that's it. Now we had the task to provide value and service beyond the products. And this is where Takeda was standing out with innovation, not only providing innovative products, but also innovative solutions. And this is where we started. We adopted the software, hardware, and everything that was needed. I'm very proud to say that we partnered in a very agile way with the governments, because there were 2 bylaws that had to be changed in order that the service of remote examination is incorporated in the system and recognized and funded by the National Health Insurance Fund. And after we changed those 2 bylaws, Serbia became the first country after US where telemedicine service is officially incorporated in the public healthcare system and fully funded and reimbursed, so totally free for the patients. After that, it was implemented in the pilot hospital, one hospital, for the period of 12 months. After that, our small team in Belgrade sat together and we started to think how we can expand and make it available to all patients, not only in this one hospital, and how we can make it even more relevant for the society. And I was lucky actually to have a chance to be able to be present in the event hosted by Japanese Business Chamber in Serbia. And UNDP presented a very interesting project that was called Just Green Transition and Decarbonization in Serbia, hosted by UNDP and Ministry of Environment, Ministry of Energy. They were calling for projects that can support the green transition, and we came back to the office and started to think how telemedicine, if telemedicine can be proven to contribute to this green transition. And we started to do the homework. We calculated how much, in the period of 12 months, how much carbon emission we saved. And we were, first of all, shocked. We were very much surprised, and we were amazed by the level of contribution that this project gave. And we calculated that for the period of 12 months, we saved 90 trees, which was tremendous. And we were encouraged to apply for UNDP support, and we won. And this was the critical point where we get additional expertise and all different types of support, and we expanded the projects in 8 additional healthcare centers. And today, I have to say that we are very proud that telemedicine is fully available in all centers that are dealing with inflammatory bowel disease in Serbia. And this is where the project ends. Not only that, it's scalable. It can be used because the public software is already adapted. It can be used by any hospital. It just needs awareness of the providers in this hospital, support from the government and from the management of the hospitals, and usage by the physician. And this is it about the project. But it brings me back to another sentence that I heard yesterday, then when there is a good idea and good projects, there is always money that can support it. And this is my call for action, which is also very similar to one that Masha stated earlier this morning. Use us. We are, specifically Takeda is here in Western Balkan, a small team of 30 people that are very committed and passionate to add value. But Takeda is a great company, and we have a very big support behind our backs. So we have a global network. In some of the innovative projects that we are currently running, we are partnering with MIT and other top universities across the globe. We have the network of different research and development centers across the world, and a lot of innovation that we can bring to the area of Western Balkans. So please do use us, and please visit the Takeda website, because you will see that we walk the talk, because the vision of Takeda is to provide better health and brighter future to the people around the globe. Thank you very much.